Doctor's warning, 5 meds. You've probably been told if your doctor prescribed it, it's safe. I believed that too for a long time, actually, until I started seeing the same patients return to my operating table. Heart attack, stroke, cardiac arrest, men and women in their 60s and 70s who did everything right, took their pills every morning, followed the instructions, trusted the system, and every single time the same medications were sitting in their daily pill organizer. My name is Dr. Kevin O'Whale. I'm a cardiothoracic surgeon. I spent over 20 years operating on hearts that didn't have to fail. Today, I'm going to tell you about 5 common medications that dramatically increase the risk of heart attack and stroke in people over 60. This isn't about scaring you. This is about giving you the information your doctor may not always have time to explain, because knowledge quite literally can save your life. Here's something most people don't realize. Aging body drug interactions. When a drug gets approved, it's tested mostly on younger adults, healthy ones, people in their 30s and 40s, with one condition, no other medications, and a liver that processes everything efficiently. But that's not you, and that's not most of my patients. By the time you reach 60, your body handles medication completely differently. Your kidneys filter more slowly. Your liver metabolizes drugs at a fraction of the speed it used to. What a 50-year-old can handle without blinking can push a 70-year-old into a cardiac event. Does that surprise you? It surprises most people when I tell them. Here's another thing. The average American over 65 takes 4 to 5 prescription medications every single day. Some take 8 or even 10. Each one was probably prescribed for a good reason. Blood pressure, arthritis, depression, allergies, diabetes. But here's the uncomfortable truth. Most of those drugs were never tested together, in combination, in an aging body. The interactions between them can be unpredictable and sometimes dangerous. I'm not saying your doctor made a mistake. I'm saying the system wasn't designed with your specific situation in mind. That gap between prescribed correctly and safe for you specifically is exactly where cardiac emergencies hide. So let's talk about the 5 medications I see most often linked to heart attacks and strokes in my older patients. Painkiller, NSAIDs, heart risk. Pill number 1, the painkiller that's hurting your heart. NSAIDs, non-steroidal anti-inflammatory drugs, ibuprofen, naproxen, diclofenac. You can buy most of them at any pharmacy without a prescription. And that is exactly what makes them so dangerous. When you're 65 and your knees ache and your back hurts, reaching for ibuprofen feels like the obvious answer. Harmless, right? It's over the counter. It's been around for decades. Here's what's actually happening inside your body when you take it regularly. NSAIDs cause your body to retain sodium and water. That raises your blood pressure. In an older heart that's already working harder than it used to, elevated blood pressure is like adding weight to an engine that's already running hot. On top of that, NSAIDs interfere with the protective lining of your blood vessels. They make platelets stickier, more likely to clump together, more likely to form a clot. A clot in a coronary artery is a heart attack. A clot in a cerebral artery is a stroke. Studies show that regular NSAID use in people over 65 increases the risk of heart attack by up to 50%. 50%, not a small number. So what should you do if you're in pain? Talk to your doctor about acetaminophen. It's much gentler on the cardiovascular system. Physical therapy, topical creams, lifestyle changes can make a real difference. Pain management doesn't have to come with cardiac risk.